Ladies and gentlemen, it is my pleasure and privilege to be taking you through the next couple of hours. For this, the inauguration ceremony of the 4th Indus Conference, ICON 2018. In addition, this marks the end of a year that we have celebrated the first decade of the Indus Hospital and the Indus Health Network. It is a pleasure to be among friends. Indus is really more of a family for us than a work environment. And alhamdulillah, I think that is the spirit behind the work we managed to achieve and the way the ICON has been put together. It's really a family working together for a common mission, a common goal, and a common passion. We have international guests with us here today. People from all over Pakistan, especially, I think this is the first event where we have a significant presence from other hospitals in the Indus Health Network. So a warm welcome to all our guests. And we would like to start with the name of Allah. Abdullah is here with us today to recite some verses from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم مثل الذين ينفقون أموالهم في سبيل الله كمثل حبة أنبتت 7 سنابل في كل سنبلة 100 حبة والله يضاعف لمن يشاء والله واسع عليم الذين ينفقون أموالهم في سبيل الله ثم لا يتبعون ما أنفقوا منا ولا أذى لهم أجرهم عند ربهم ولا خوف عليهم ولا هم يحزنون قول معروف ومغفرة خير من صدقة يتبعها أذى والله غني حليم يا أيها الذين آمنوا لا تبطلوا صدقاتكم بالمن والأذى كالذي ينفق ماله رئاء الناس ولا يؤمن بالله واليوم الآخر فمثله كمثل صفوان عليه تراب فأصابه وابل فتركه صلدا لا يقدرون على شيء مما كسبوا والله لا يهدي القوم الكافرين ومثل الذين ينفقون أموالهم ابتغاء مرضات الله وتثبيتا من أنفسهم كمثل جنة بربوة أصابها وابل فآتت أكلها ضعفين فإن لم يصبها وابل فطل والله بما تعملون بصير أيود أحدكم أن تكون له جنة من نخيل وأعناب تجري من تحتها الأنهار له فيها من كل الثمرات وأصابه الكبر وله ذرية ضعفاء فأصابها إعصار فيه نار فاحترقت كذلك يبين الله لكم الآيات لعلكم تتفكرون صدق الله العظيم. Thank you.
Jazakallah. I would like to read the translation out so that we focus on really what is the driving spirit behind Indus, and that is philanthropy. The example of those who spend their wealth in the way of Allah is like a seed of grain which grows 7 spikes. In each spike is 100 grains, and Allah multiplies His reward for whom He wills. And Allah is all-encompassing and knowing. Those who spend their wealth in the way of Allah and then do not follow up what they have spent with reminders of it or other injury will have their reward with the Lord, and there will be no fear concerning them, nor will they grieve. Kind speech and forgiveness are better than charity followed by injury, and Allah is free of need and forbearing. O you who have believed, do not invalidate your charities with reminders or injury, as does one who spends his wealth only to be seen by the people and does not believe in Allah and the last day. His example is like that of a large smooth stone upon which is dust and is hit by a downpour that leaves it bare. They are unable to keep anything of what they have earned, and Allah does not guide the disbelieving people. And the example of those who spend their wealth seeking means to the approval of Allah and assuring reward for themselves is like a garden on high ground which is hit by a downpour, so it yields its fruits in double. And even if it is not hit by a downpour, then a drizzle is sufficient, and Allah of what you do is seeing. Would one of you like to have a garden of palm trees and grapevines underneath which rivers flow, in which he has from every fruit? But he is afflicted with old age and has weak offspring, and it is hit by a whirlwind containing fire and is burned. Thus does Allah make clear to you His verses that you might give thought. Sadaqallahu al-Azim. Ladies and gentlemen, Dr. Junaid Patel is the chairman of the organizing committee for ICON 2018. It has been a tough year for Dr. Junaid, and I think he is willing to have a nice long nap after Sunday. But until then, I'm going to request him to welcome all of you and open the ceremony.
Thank you, Lubna. And it's been pleasure and honor, but yes, tiring. So, Assalamu alaikum all. On behalf of the organizing committee, I would like to extend a warm welcome to all delegates at Indus's 4th Biennial Conference, ICON 18. Our hope is that we have managed to put together a good conference that stimulates both our clinical knowledge and scientific intellect. The focus of this year's conference is on redefining healthcare, which is an important theme that resonates in Indus's 10 years journey from one hospital campus to the Indus Health Network, covering several hospitals across Pakistan, combined with a robust public and community health approach through the Global Health Directorate, and soon transforming into Indus's Health Science Center, the university. As the organizing chair of this event, I hope that this conference is memorable for the participating delegates, with a plethora of invaluable knowledge being gained in their respective areas of interest. I would like to express my deepest gratitude to the enormous effort put together by the organizing committee in planning this conference, lecture, discussions, hands-on workshops with redefining healthcare theme in perspective. The team consisted of a group of diverse professionals whose sincere and tireless efforts made this conference possible. I'm also thankful for the invaluable tips and knowledge passed on to us from the previous organizing committee members and our seniors. I have learned a lot from my colleagues and friends and will continue to do so. Lastly, I would like to convey my heartfelt gratitude to all the distinguished speakers, workshop facilitators, sponsors, Indus management, volunteers for graciously coming together to make ICON 2018 a truly exceptional learning event. We hope that this biennial multidisciplinary conference will provide the perfect forum for all delegates to interact and redefine our attitudes towards a healthier life and appreciate the need for a more holistic approach to health. Looking forward to engaging with you throughout the conference days. Enjoy ICON 18. Thank you.
Our keynote speaker for today is Dr. Sania Nishtar. She currently co-chairs the WHO High-Level Commission on NCDs and is also the co-chair of the US National Academics Global Study on the Quality of Healthcare in Low and Middle-Income Countries. She's a recipient of Pakistan Sitara Imtiaz, and she has served in the Interim Federal Cabinet in 2013, overseeing health, science and technology, information technology and higher education. She has come for a very short trip to Karachi just to be with us today. And I know that she's taken time out from a very busy schedule. Dr. Sania, thank you very much for being with us here today. I request you to please come here and give us the keynote address.
Bismillahirrahmanirrahim. Dr. Bari, Secretary Health, ladies and gentlemen, let me begin by congratulating Indus Hospital system for this biennial conference that they are celebrating yet again. And let me thank Dr. Bari and all the sponsors of Indus Hospital who I see here today for the miracle of Indus Hospital, for the value you bring to the people of the city and of the province, and of showing such a positive face of Pakistan to the world abroad. Thank you very much indeed for that. I have been asked to talk about what it would mean to redefine healthcare. And in order to do a redefinition, you would like to look at the status of health in the country today. Of course, we have the islands of excellence. Of course, we have the Indus hospitals and the SIUTs. But notwithstanding those promises, notwithstanding those successes, when we talk about health in the country, there are certain images that come to our mind. It is the poor indicators, the ill health of the people, the 16,000 strong basic health units of the country that remain underutilized, the overwhelmingly overworked tertiary health units, the collusion and inefficiencies in the regulatory system, and that is what actually comes to our mind. And clearly I don't have to be reiterating that there is need for change. When we talk about change in the health sector, there are certain endpoints that we have to aspire towards, and clearly in the health sector, our endpoint is universal health coverage and health for all, for every individual in the country, in geographic access terms, in financial access terms, and with quality. So when we aspire towards such an outcome, it is always very useful to look at the experiences of other countries in a post-Second World War world, and to ascertain what the ingredients of their success were, because that has implications for how we might do our restructuring. And when you reflect on international experiences, there are clearly some models that clearly stand out. Let's quickly run through those. United Kingdom is thought of as the bastion of universal health coverage. United Kingdom set up its National Health Services Plan in 1946 at the same time as a plan was created for the subcontinent by the same individual whose name was Beveridge. And the ingredients of success there have been fiscal inputs, a strong culture of accountability within institutions, and a very high civic awareness. Let's look across the English Channel. Scandinavia is thought of as the bastion of universal health coverage, and there the ingredients have been their strong character of social welfare and the strong citizen to state contract from which the health sector has enormously benefited to deliver universal health coverage. And then there are other countries who were able to achieve universal health coverage more recently, such as smaller countries such as Singapore, Hong Kong, Taiwan, and the Gulf Cooperation Council countries. And there the ingredients of success were a balance between the fiscal envelope and the size of the population. In yet another countries, in yet another category of countries, the ingredients of success have been the robustness of their research institutions. And I refer in particular to countries like Iran and Thailand. Iran actually is quite an amazing example of how institutional robustness can achieve health for all. Here was a country which was under sanctions for many decades, where a donor never stepped foot, and despite that, its indicators is something that the rest of the world is emulating. So the research architecture, the long-term investments in higher education in countries like Thailand and Iran have been the enabling factors. And in yet another category of countries, and Latin America is a salient example of that, it is the combination of two things that has made a difference. Number one, a constitutional entrenchment of the right to health, and a societal political awareness which demanded that the right to health be judicialized. And that was evident very clearly during the time when HIV/AIDS became a problem in Latin America, and we saw that civil society groups started going to courts and demanded that the high-cost antiretroviral treatments be provided by the state for free. And that was the basis of the movement towards the judicialization of health rights, and subsequently for policies and implementation that led to health for all. So across the world, in a post-Second World War setting, when you look at country examples of what has delivered health for all, there are certain ingredients at play that continuously come up. Adequate resources balanced with the size of population, the robustness of institutions, a societal political awareness, and a strong culture of accountability. And when you reflect upon your own country situation and analyze how these would potentially play out, we have to bring to bear that there is a very wide chasm. There is no correlation between the size of the fiscal envelope and the population, and in fact two of the most horrific trend lines that we have in our national system is the size of the fiscal envelope, which goes down, and the population trend line, which is upwards, and the census has recently been conducted, and I don't need to elaborate on that again. The status of accountability of our institutions, the status of research is something in front of you, and I don't have to elaborate on that further. So, what is the answer then? The answer then is to be very disruptive in your thinking, and to be constructively disruptive, and to think of those opportunities which would cascade broad-based change with technology, with the recent advancements that the private sector has espoused as a matter of general principle and habit. Let me give you some quick examples to bring to bear what I'm trying to communicate. According to estimates, we know that 50% of the medicines in Pakistan are spurious, they're fake, they're substandard, they are suboptimally produced. And because of the size of the black market, because of the complicity of some non-bona fide manufacturers, wholesalers, retailers, and even doctors, we know that this is a nut which is very difficult to crack, and Secretary Health will bear me out, through regular regulatory approaches. What is the answer to this? The technology-based answer to this is the implementation of mass serialization coupled with text messaging, which can authenticate drugs through hidden codes. In fact, the recent advent of blockchain, through the custody of chain that it enables, can weed out counterfeit and spurious drugs. And here is a potential that countries like ours could potentially tap with challenges with regulatory regimes. Let's look at another potential example which could cascade broad-based change. Pakistan has an amazing infrastructure of 16,000 plus primary healthcare units, but there are issues of absenteeism, hemorrhaging supply chains. And through the introduction of some regular run-of-the-mill technologies that the private sector uses as a matter of principle, such as video surveillance, which every fast food chain and bank uses, and GPS location technologies and supply distribution chain security measures, all these things can be plugged. We can talk about something else. I mean, quackery has been endemic in the country for very long. We've been lamenting about worker shortages all our life. But with some of the newer models of virtual healthcare, which deploy artificial intelligence, which deploy online tools, which deploy machine learning, we don't have to worry about quackery anymore, or the issue of worker shortages could be eliminated to a very large extent. And science and data now precisely tells us that it is possible. Let's look at another example yet. Science tells us that 70% of disease today, even in countries like ours, is lifestyle driven. But then on the other hand, millions of people have cell phones in their hands where knowledge access, data portability, and processing power converges. And what could this mean for lifestyle change, for individual behavior modification, for accessing online virtual hospitals and clinical networks, which I know that Indus Hospital must be thinking towards and moving towards. So there are a whole host of run-of-the-mill technologies which are in everyday use, and some that are burgeoning and on the horizon, which have the potential to transform healthcare even in a country like ours, where the traditional ingredients of change to achieve healthcare, health for all, are not available. And we must get our act together to ensure that we are fully equipped to deploying them, because the private sector and private entrepreneurs do it as a matter of principle. So I want to talk to you about the 5 things that we could potentially do to ensure that we are geared up for that change. And I know that hospital systems in the private sector, hospital systems like Indus Hospital, would be the first ones to embrace it. So what are those 5 levers of change? And the first change is that when you plan for change, there have to be certain ingredients at play. You have to ensure that you embed change in a theory of change paradigm, that you draw on evidence, and that you use the right incentive structures for change. And incentives, I'm sure you know, doesn't just mean money. It means the motivation to do the right thing. And we must clearly ensure that that is in place. Secondly, we have to realize that in order to build new systems or to transform existing ones, we have to draw on the knowledge and on the skills and on the capacities and the resources of a number of different sectors, both in the public and the private worlds, and in the different spheres of the government. Try and develop and deploy any solution, and you will realize that there is an interplay of many different ministries, as the senior bureaucrat here will tell you. And that is where, especially in the government system, the challenge lies. We generally think that the government is one entity, but the government is actually not one entity. It is an archipelago of many institutions and ministries and departments which have a disincentive to collaborate. And in order to deploy the right solutions in the government or in the public system, we have to develop new institutional competencies. We have to develop incentives for asset allocation mapping, incentives for collaborative division of labor, and metrics for whole of government performance, rather than metrics individually for ministries and sectors. And that's another paradigm change that is imperative if we need to transform our institutions. Thirdly, we have to realize that there is a knowledge and skill deficit. And that knowledge and skill deficit is not specific to Pakistan. In today's digital age, even countries as resourceful as the United States is appreciating that the capacity of public institutions and private systems and regulatory bodies is not keeping up with the pace of technological developments. And therefore, it is critical that we invest in the right human resource capacities. We now know that human resource in today's digital age contributes to 70% of the global economy, much more than physical assets. And therefore, it is imperative that we invest in those. And we need to invest in a human resource of a very different category. During the first industrial revolution, there was a need for unskilled workers who had to power the cotton mills. And today's digital age demands a new skill set of experts to power our systems, to manage them, to evaluate them, to take them to scale. And even the most developed countries are finding it difficult to do that. So we need to do a lot of introspective thinking of how we can jumpstart that. But we have to be mindful that Pakistan has a huge potential with its youth bulge. Number 4, we have to ensure that we have the right capacity to develop the new standards, norms, and ethical frameworks within which these new operating systems can maximally flourish and deliver. And let me give you a small example of that. For instance, data is the backbone for all change in changing institutional and individual behaviors. But when we talk about data in the health sector, we're not just talking about electronic medical records and data from registries and surveys and surveillance anymore. We're talking about data from wearables and watches and personal fitness devices and from smartphones that track your behavior. We're talking about consumer-driven data from genetics and genomic testing, and we're talking about data from predictive analytics, which are modeled on individual behavior, and data from the Internet of Medical Things, which is now commonly used in clinical practice. And therefore, we have to be mindful that along with these new developments, there are a number of different corollaries. So drawing on this data example, there's need for reflective thinking on what about data privacy and data security and data ownership, and how do we develop the ethics and standards, and how will regulatory systems keep pace with this? So just to bring to bear that even in the most advanced countries of the world, these ethical questions, these normative questions, they're still grappling with these questions, and what to talk about settings like ours. So we must commence thinking to grapple these things at an appropriate time. And my 5th point is about cost. Today, in the health systems of the future, we are seeing remarkable improvements. We are seeing remarkable developments on a daily basis. Robotics and virtual reality is transforming how imaging will be perceived in the future. It's transforming surgery and microsurgery and so many other disciplines. The Internet of Medical Things is revolutionizing how chronic care will be dealt with in the future. This year, at the top of the future innovations was an artificial womb. So we now know that preterm children can actually be nurtured in an artificial womb outside. We also know that cancer therapies, which cost hundreds of thousands of dollars and if focused on precision medicine, can significantly improve clinical outcomes for patients and have implications for longevity. But all these things, and of course I can go on and on with the list with gene therapy and what that means for individual disease and precision medicine. There's a long list of things at the cutting edge of the new frontiers of science and technology, which is reshaping the whole rubric of healthcare. But along with that comes a price tag. And I think it is imperative for the developing world to speak with a collective voice, to to do some introspective thinking about how the cost and the financial access challenge is going to be overcome. So in a nutshell, there are a number of new developments. Healthcare is not at the cusp of change. It is already undergoing a major transformation. But it is critical that we as a developing country think about how norms and standards are going to be developed, how we will develop our capacity to develop and then scale up the new systems, how we're going to ensure the human resources that have the capacity not just to run those, but also the capacity to develop and deploy those, and then do some thinking about overcoming financial access barriers. So in the end, I would only like to say that this is a change we have to bring ourselves, because gone are the days of the Millennium Development Goals when donors used to come to countries with compacts, assisting them with specific asks and providing catalytic money for that. The Sustainable Development Goals have brought a very different paradigm compared to what was the norm in the area of the Millennium Development Goals. The onus is very much on strengthening country institutions and systems so that the international system can focus on where it has a comparative advantage, and this is exactly where it ought to be. Countries should be responsible for their own planning, for their own implementation, for their own evaluation, and for their own resource inputs. Health provides us, quantum change in the health sector provides us with a wonderful opportunity to show to the rest of the world what is achievable in a developing country setting. And I think that with the success of the Indus Hospital, we have every reason to believe that it is possible. We can not only improve lives with changes in the health sector and improve human well-being, we also know that the right inputs in the health sector can also be a vehicle for fueling economic growth, and the right inputs into the health sector can also restore Pakistan's international image, which was unfortunately badly tarnished during the polio epidemic, and now it is on the way to being restored. So health is a several-edged weapon, should I say, improving human well-being, improving systems, improving the economy, and good for health diplomacy. And I would urge you to listen to the successes of the Indus hospitals, and I would urge you to do some reflective thinking on how we can step up capacity to go into the next generation of healthcare, into the future health system, which holds promise for the millions of underserved people in our country. I want to thank you for having me here. I want to thank you for honoring me. I want to thank you, Dr. Bari, once again for all the work that you do. And I want to thank you, sponsors, for showing the world such a positive, such a compassionate face of our country. Thank you very much for having me here.
Dr. Bari, could I please request you to come on stage? Dr. Sania Nishtar has to be heading to the airport very shortly, so we would like to request Dr. Bari to present a small memento to remind us of her presence here with us, and a reminder that we look forward to your continued cooperation as we continue to grow the Indus Health Network across Pakistan. Ladies and gentlemen, 10 years ago, Indus Hospital started as an unknown, small 150-bed hospital in a peripheral part of Karachi. As Karachi has grown, Indus is probably now more central than it was 10 years ago. But it has also become the center of a movement. Some call it a miraculous expansion. But many of us know that there has been a lot of hard work, a lot of effort behind this miracle. A number of people have made this miracle possible. I think all of us here who are proud to be a part of the Indus Hospital are even more proud to know that we started, we were there at the start of the Indus Health Network. We have a 9-minute video documentary chronicling this journey from a hospital to a health network. And at the end of that video, I would request Dr. Bari, who is the CEO of the Indus Health Network and one of the founders of the hospital, to come and give his vision for where we see ourselves in the next decade. Sir, are you ready with the video?
Pakistan is the 6th most populous country in the world, with a rapidly increasing population of over 195 million. According to careful estimates, 30% of the country's population is living below the poverty line. The public and private healthcare facilities all over Pakistan are insufficient to meet the growing population's needs. Some of the rural and urban areas are severely underserved in terms of healthcare provision. Keeping this scenario in perspective, in the year 2005, a group of dedicated doctors, professionals and philanthropic entrepreneurs laid the foundation of Pakistan's one-of-its-kind welfare hospital in the metropolis of Karachi.
इंडस हॉस्पिटल की बुनियाद इस वजह से पड़ी थी कि पाकिस्तान में जहां 200 मिलियन से ज़्यादा लोग रहते हैं, दो हेल्थ सेक्टर के दो ही थे, या प्राइवेट हॉस्पिटल या पब्लिक सेक्टर हॉस्पिटल। पब्लिक सेक्टर हॉस्पिटल में जहां हर मरीज एक नई कहानी लेके आता था, कोई अपनी भैंस बेच के आता था, कोई बकरी बेच के आता था, कोई अपने घर बेच के आता था। हम लोगों ने मिलकर सोचा था कि एक हॉस्पिटल बनाएं जो कि ऐसा हॉस्पिटल हो जहां पर क्वालिटी केयर हो और फ्री ऑफ कॉस्ट हो।
The Indus Hospital provides absolutely free of cost treatment to all patients, and it is the first hospital in Pakistan that runs on a completely paperless system. Here, patients are provided with quality healthcare free of cost without discrimination. Equipped with state-of-the-art medical facilities, a passionate team of doctors and paramedics, the Indus Hospital provides treatment that is aligned with globally recognized healthcare standards.
इंडस अस्पताल जो है उसको अब इंडस हेल्थ नेटवर्क कर दिया गया है, इसलिए कि ये एक यूनिट की बजाय एक कॉन्सेप्ट को, एक फ़लसफ़े को कवर कर ले, जिसके मायने ये है कि क्वालिटी हेल्थ केयर तमाम लोगों के लिए बग़ैर तफरीक के मुहैया हो और पूरे पाकिस्तान में मुहैया हो, और प्राइमरी, सेकेंडरी और टर्शरी तीनों लेवल्स पर ये लोगों को मुहैया हो जाए इंशाअल्लाह।
Starting off operations with 150 beds in 2007, the Indus Hospital has now grown to form a healthcare network, with hospitals in Karachi, Badin, Muzaffargarh, Bhong and Lahore. In Karachi, the Indus Health Network has 3 hospitals. The Indus Hospital Korangi is a 300-bed tertiary care hospital. It has been recently added with a new pediatric complex, which has a pediatric emergency, pediatric medicine and surgery services. In addition to that, the Children Cancer Hospital is also housed within this facility. The Children Cancer Hospital caters to more than 1,000 children suffering from cancer annually. Sheikh Saeed Memorial Hospital is a full-service 70-bed obstetrics and gynecology unit located in Korangi. The Indus Hospital Al Fakir Trust Campus is a 20-bed dialysis and family medicine unit located in the densely populated area of PIB Colony. The Indus Health Network has a hospital in Bhong near Rahim Yar Khan. Al Ghazi Campus Bhong is a 50-bed secondary healthcare facility. Under the public-private partnership agreement with the government, the Indus Health Network manages 3 hospitals, namely Civil Hospital in Badin, Shahbaz Sharif General Hospital in Lahore and Tayyip Erdogan Hospital in Muzaffargarh. The Indus Health Network has treated millions of patients and performed thousands of high-impact surgeries at its healthcare facilities for underserved patients all across Pakistan. The Indus Hospital is soon opening its full-service hospitals in the cities of Peshawar, Lahore, Mansehra, Multan and Quetta.
अगले 5 साल में इंशाल्लाह हम इंडस हेल्थ नेटवर्क को चारों सूबों में और गिलगित बल्तिस्तान में टर्शरी केयर के साथ इंशाल्लाह ले जाएंगे और कराची में हमारी मेडिकल यूनिवर्सिटी भी क़याम में आ चुकी होगी.
Because of poor economic conditions and lack of accessibility to quality healthcare in the country, a large number of patients turn to Indus Hospital with high hopes and expectations. Due to the constant increase in patients' numbers, we are continually trying to expand our existing facilities. The Indus Hospital's main campus in Korangi, Karachi is now expanding its capacity by many folds.
इंडस हॉस्पिटल इस वक्त एक ऐसे मोड़ पे आ गया है, हम अपना अस्पताल को बढ़ाने और इसको एक्सपेंशन करने में लगे हैं. हम ये चाहते हैं कि जल्द से जल्द ये एक्सपेंड हो जाए और मरीजों का ज़्यादा से ज़्यादा मरीजों का मज़ीद फ़ायदा हो.
This mega expansion plan is expected to be completed by 2024. The number of beds in the hospital will increase from 300 to 1800. Emergency room beds will increase to 104. After expansion, more than 5,500 patients will benefit from treatment on a daily basis.
ऐसा पाकिस्तान हमें चाहिए जहां पर कोई अपनी चीज ना बेचे, तो ये अपना घर से बेघर ना हो और उसको ट्रीटमेंट मिल सके और क्वालिटी की ट्रीटमेंट मिले और फ्री ऑफ कॉस्ट मिले.
We firmly believe that no human being should be denied the basic right of receiving quality healthcare due to his or her inability to pay for it. However, it is not an easy task. Let us all join hands to help Pakistan become a model welfare state. Donate to Indus Hospital. Visit www.indushospital.org.pk or call 021 111 111 880.
बिस्मिल्लाहिर्रहमानिर्रहीम रब्बि इश्रह ली सदरी वयस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली हस्बुनल्लाहु व निअमल वकील निअमल मौला व निअमल नसीर. Respected Dr. Sakar Bandrev Sahab, Dr. Naveed Kamran Baluch Sahab, Secretary, Federal Secretary Health, SM Munir Sahab, हम सबके भाईजान, और यूनुस बंगाली साहब, बोर्ड के चेयरमैन, सिद्दीक साहब, प्रीवियस चेयरमैन, और हाफिज फिरोज साहब, और मेंबरान ने बोर्ड ऑफ डायरेक्टर्स ऑफ इंडस हॉस्पिटल. अस्सलाम वालेकुम व रहमतुल्लाहि व बरकातुहू. For over 10 years, I have spoken to countless audiences on multiple platforms in various continents. Getting people to believe and share a dream has been my job description since my student days. Today I stand in front of you to share the outcomes of our belief where this is taking us. To understand what Indus has achieved and its future direction, it is important that the dream itself is revisited. The why part of the equation is the simplest: to please Allah subhanahu wa ta'ala. This is the fundamental reason of the existence of Indus Hospital. The ground realities and backup against which our path has evolved does not make for a pleasant reading. Yes, we live in a world of constraints and are surrounded by a multitude of challenges. The government and society has been trying to bridge the divide between demand and supply. But there are huge disparities, some documented, some not. While there are reasons for such a situation, and whether they are justified or not, what is not disputed is the fact that these affected most are the least fortunate and vulnerable in society. One doctor for 1,200 people, one nurse for over 2,300 people, endless numbers that most of you are either aware of or have experienced the effects of. These numbers also represent an opportunity for dreams to germinate, take root, and blossom into an initiative that make people believe again. And that is how this journey began 10 years ago. Working in the public sector during the formative years of personal realization allowed the experience to shape development of an empathetic conscience. Witnessing firsthand extreme need coupled with helplessness and our inability to make a real difference shook us to the core. Were we playing the roles of saviors in times of their desperation? All that should have been done could not have been done. The paradigm had to shift. Dreaming of a vision that entailed exceptional care without exception and turning it into a reality was a God-given opportunity. A system that provides empathetic care to those in need, free of cost, where decisions are made based on the clinical need rather than the ability to pay. This was to be formulated with an emphasis on quality, to a standard where Indus is the destination of choice and not a choice made in desperation. The dream was a bold one and was enabled by many unique features. We pride ourselves in being paperless and cashless. Patients do not need to spend a single rupee during the entire treatment journey. Using cutting-edge health delivery technologies enabled efficiency and intervention at the patient's doorstep. Patient need and disease severity are the sole decision drivers. This model system extends beyond the boundaries of the main campus of Indus Hospital, Korangi, and has affected countless lives. Success can be measured in many ways. What we managed to deliver and the manner in which we delivered was seen as a beacon of hope to various organizations, donors, and provincial governments. Our aim of creating a network throughout the country found enabling implementation platform. We are now present in all provinces of the country in the form of campus, blood center, rehabilitation centers, or as a primary care initiative. What started with a handful of like-minded colleagues has grown to over 7,500, 15 accredited residency program with over 150 residents and with an annual budget of about 15 billion rupees, impacting about 2.4 million patients a year. The fourth edition of the ICON conference is testimony of our emphasis and focus on research. The span of our presence accelerated the need to create a functional governance structure that allowed for a decentralized approach with a strong centralized monitoring. The intent was for the network governance to represent all functional aspects with a special emphasis on quality. The Indus Health Network comprises of 8 directorates: medical, operations, finance, rehabilitation, communication and resource mobilization department, global health delivery, academics and quality and monitoring. With the top tier defined, the various entities and functions are further distributed among 3 additional tiers: the head office, campus, and regions. As with most of the things in life, this will remain a fluid governance structure which will further evolve as and when needed by the network. Some changes are foreseeable, such as those that will come with further development on the university front. The journey has been 10 years long, but there is still much to do. Perhaps more than what was realized at inception. The dream keeps getting bigger. New concepts are being explored, such as redefining healthcare in a manner that focuses on value rather than volume. Mindsets rewired where servitude is coupled with gratitude. The reality is that working to please Allah is directly working for Allah. We are lucky to be chosen as His instrument to deliver and implement. We all have important roles to play. We believe in contributing to the development of the society. Imperfect conditions are opportunities for individuals and institutions to rise and be counted, in this world and hereafter. Hasbunallahu wa ni'mal wakeel, ni'mal mawla wa ni'mal nasir. काफ़ी है मेरा रब मेरे लिए मेरा अल्लाह, बेहतरीन कारसाज है, बेहतरीन मौला है और बेहतरीन मददगार है. जज़ाकल्लाह खैर.
Professor Adib Rizvi was supposed to be with us tonight, but unfortunately he has not been keeping very good health. So he has given his regrets. Our prayers are with him for his speedy recovery and many more years. May Allah bless him with many more years to do the good work that he does for Karachi and for Pakistan. Mr. S.M. Munir is our next speaker. He is the Chief Executive Officer of the Trade and Development Authority of Pakistan, a recipient of the Sitara Israr and the Sitara Imtiaz in 2006 and 2007 respectively. His influence in the economic sphere has grown to involve into an involvement in the education and health sectors as well, and he has been a strong supporter of Indus Hospital and Indus Health Network. He has been awarded the Lifetime Achievement Award by the President of Pakistan in 2012, and he is here with us today. I request him to please come up to the mic.
Bismillahirrahmanirrahim. Honorable Provincial Ministers in Health Minister, Secretary Health, Sardar Yasin Malik Sahab, Admiral Hussaini Sahab, our great Sadiq Sheikh Sahab, worthy speakers, ladies and gentlemen, Assalamu alaikum. It's indeed a great pleasure to attend today's 4th Health Network Conference, ICON 2018 of Indus Hospital. In a place like Pakistan, where the government provides a small amount of total health expenditure and the remainder being taken care of privately and through out-of-pocket expenditure. 3 large government hospitals in the city of Karachi are largely inadequate to meet the demands of a city with a population of over 20 million. According to the Economic Survey of Pakistan, the government spent about 0.5 to 0.8% of the GDP on health for the last 10 years, while the WHO benchmark of health expenditure is at least 6% of the GDP. As a result, majority of the poor population of the country has to pay for private health care services. The private sector remains largely unregulated. More than often, complex procedures are undertaken in clinics and smaller hospitals which are totally unequipped to deal with the complications that occur during whilst conducting a procedure. Most of the private clinics sprouting up a staff with untrained medical professionals that cause havoc with the health of the patient. More than often, private sector healthcare services serve to fleece patients who are at their mercy due to the lack of any checks and balances. Surely the people of Pakistan deserve something better, and in this scenario, the Indus Health Network serves as an oasis of hope for those who cannot afford the quality care offered by select few hospitals of the country. The Indus Health Network serves to provide quality health care to the underserved of this nation through its hospitals located all across Pakistan and does not charge a single penny from its patients. It provides comprehensive, multidisciplinary and quality treatment to its patients. The Indus Hospital serves service by some of the top-ranking medical and therefore runs on properly enforced system and processes. They conduct high-impact surgeries such as knee replacement procedures and cochlear implants to name a few. These surgeries and treatments are conducted in state-of-the-art facilities with cutting-edge technological equipment by some of the best doctors in the city. Thank you. The Indus Hospital does not charge a single penny for any of these high services, and this in effect serves to give the gift of health to these patients. I am being told that the Indus Health has inclusive all its hospitals from all over Pakistan is able to treat 200,000 patients per month and conducts over 6,000 procedures at its facilities per month. In addition to this, it has public health outreach program to tackle endemics in the city such as tuberculosis, malaria, rabies, hepatitis B and C. A blood center that is run on international standards which serves to promote voluntary blood donations in the country and a physical rehabilitation center. I would say need many more of such institutions to help make a difference in the lives of those confronted with poverty each day. The Indus Hospital is now expanding in Karachi and building another hospital from scratch in Lahore. I urge the civil society and the corporate sector to come forward and invest in the healthcare so that we can develop our nation through a healthy and productive population. I am very proud to say that philanthropy is on the rise in Pakistan. In the World Giving Index 2017, Pakistan has been noted to be amongst the top 10 generous countries in the world. Most Pakistanis are said to make charitable donation or volunteer at the time. It has been recorded that over rupees 250 billion a year is given in philanthropy activities, while corporate Pakistan is recorded to be giving less than 0.7% of products back to the society as charity. This has been brought to the fore by the Pakistan Center of Philanthropy, PCP, in two separate studies. Interestingly, it has also been noticed that individuals prefer giving extending donation to other individuals over institutions and organizations, as the help goes directly to the needy, disabled and beggars, especially in the case of non-zakat monetary contribution. Therefore, I would urge the corporate sector to come forward and invest in the human capital of the nation by donating to sound institutions that are providing the services of healthcare and education, the two backbones on which great nations are built upon. I would like to appeal to the entire corporate sector to come out and donate generously to organizations that work with excellence, transparency and accountability to provide public goods such as health and education to the people of country. Such organizations make sure that your donation make an impact on the underserved in the country and improve the development indicators of our country. We as the corporate sector have a responsibility to give back to the people of the country that enable us to reap such high profits. मुझे इस बात की बड़ी खुशी है कि मिनिस्टर ऑफ हेल्थ मौजूद है, सेक्रेटरी हेल्थ भी मौजूद है, और लेकिन ये मैं कहना जरूर चाहूँगा कराची इज बिकम सच अ डर्टी एंड फिल्दी सिटी. कराची को कुछ ना कुछ आपको करना पड़ेगा. मैं कई दफा चीफ मिनिस्टर को भी कह चुका हूँ, और कराची में इसी वजह से बीमारियां बढ़ रही हैं. आज हर घर में एक दो बंदे बीमार पड़े हैं. मैं खुद मेरी पिछले 15 दिन से तबीयत ठीक नहीं. बात यह है कि कराची का कुछ ना कोई इलाज करना पड़ेगा. अगर आप सफाई नहीं करेंगे तो बीमारियां बढ़ती चली जाएंगी और फिर आपके कंट्रोल से बाहर हो जाएंगी. मिनिस्टर साहब, डॉक्टर वारिद साहब, मैं आपको मुबारकबाद देता हूं. आप एक फरिश्ता सख्त इंसान है. आपने इतनी मेहनत की. कहना خواتین حضرات کہنا بڑا آسان ہے. میرا چھوٹا بھائی بھی اس ساتھ ڈائریکٹر ہے انڈس میں. یہ دن رات کام کرتے ہیں اور کوئی چارجز نہیں, زیرو چارجز. بڑے سے بڑے آپریشن بھی آپ کرائیں انڈس میں, اگر میں بھی جاؤں گا مجھ سے بھی چارجز کوئی پیسے نہیں لیے جائیں گے. میں ان کے لیے دعا کرتا اللہ ایک جو نیا جو ہسپتال بنانے میں کامیابی کرے, ہسپتال آپ کا کامیابی سے بن جائے. پاکستان کی بات کرنا چاہوں گا خواتین حضرات. آل پاکستان میں تمام انٹائی پاکستان فورسز آر ویری ایکٹیو ٹو کریٹ پرابلم فار مائی کنٹری. پاکستان میں ان اینڈ آؤٹ آف پاکستان جتنے بھی ہمارے دشمن سب ایکٹیو ہے. آپ نے خود نظر آتے ٹیلی ویژن دیکھنے سے شرم آتی ہے کہ پتہ نہیں پاکستان میں کیا ہونے, اور ڈر لگتا ہے. اس لیے میں آپ سب کو ایک ہی درخواست کرتا ہوں, یہ ہمارا پاکستان ہے, یہ ایک باغ ہے, اس باغ کے گارڈن میں صبح اٹھ کے تھوڑا سا پانی ڈالیں. مطلب یہ کہ تھوڑا تھوڑا آپ بھی ہیلپ کریں پاکستان کی, انڈس کی بھی ہیلپ کریں, اور جہاں مدد کر سکیں پاکستان چلے اس لیے کہ پاکستان میں آپ جیسے اچھے لوگ موجود ہیں جو ہیلپ کر رہے ہیں مین کائنڈ کی. پاکستان کے اس باغ میں جب پانی ڈالیں گے اتنے پھل نکلیں گے, آپ بھی کھائیں گے, آپ کے پوتے بھی کھائیں گے, آپ کے نواسے دوتے بھی کھائیں گے. اور اگر ہم نے یہ نہیں کیا تو آنے والے دنوں میں ہمارا پوتا ہمارا گریبان پکڑ کے بولے گا دادا ابو یہ پاکستان آپ ہم کو دے کے گئے تھے. ایک بڑا اچھے شعر ہے, میں ہمیشہ پڑھتا ہوں پاکستانیوں کے لیے, داغ سجود تیری پیشانی پہ ہوا تو کیا, پاکستان آپ کے نمازیں پڑھ گیا, آپ کے سجدے کا نشان بن گیا, محراب کا نشان بن گیا. داغ سجود تیری پیشانی پہ ہوا تو کیا, اگر کوئی سجدہ اگر پاکستانی کوئی سجدہ ایسا بھی کر زمین پہ نشان ہے. داغ سجود تیری پیشانی پہ ہوا تو کیا, کوئی سجدہ ایسا بھی کر کے زمین پہ نشان ہے. اگر ہر پاکستانی سوچ لے کہ تھوڑا تھوڑا میں نے اپنے پاکستان کے لیے کیا کرنا ہے, تھوڑا تھوڑا وقت دے, تھوڑا تھوڑا اپنے پاکستان کی فکر کرے, تو انشاءاللہ اسی زمین سے ہم سب نے کمایا. آج جو بھی کچھ ہے یہی ہے. اگر میں پاکستان میں نہیں ہوتا, ہندوستان میں ہمارے سے زیادہ مسلمان ہیں, دے آر آل سفرنگ, ان کا برا حال ہے. آج ہم آزاد فضا میں رہتے ہیں اور یہ ہمارا فرض ہے اپنے پاکستان کی فکر کرے اور ہمارے انڈس ہسپتال کی سب فکر کرے. اللہ تعالیٰ سے دعا ہوں, اللہ تعالیٰ مجھے اور آپ سب کو پاکستان کی خدمت کرنے کی توفیق عطا فرمائے. تھینک یو ویری مچ.
Thank you very much, Munir Saab. We are graced by Dr. Sikandar Mandro, Provincial Health Minister's presence here today. I think the participation of the Health Minister as well as the Federal Health Secretary demonstrates the strong ties between the public and the private health sectors, and that really has been one of the strengths that Indus has brought in the past few years. May I request Dr. Mandro to please come and say a few words.
بسم اللہ الرحمن الرحیم. محترم کامران بلوچ, فیڈرل سیکرٹری نیشنل ہیلتھ سسٹم, ایس ایم منیر صاحب, ہمارے دوست ڈاکٹر باری صاحب, فلانتھراپسٹ, انٹرپرینیئرس, ڈاکٹرز, لیڈیز اینڈ جینٹلمین, السلام علیکم. ایک شاید حدیث ہے, اگر میں غلط نہیں کہہ رہا, افضل الناس من خدمت الناس, جو سب سے بہتر انسان ہے وہ وہی ہے جو انسانیت کی خدمت کرتا ہو, جو انسان ذات کے بھلے کے لیے جیتا ہوں. ہم سب کا فرض ہے کہ ہم جو اس دنیا میں آئے ہیں تو اپنی خدمت تو ہر کوئی کرتا ہے, ہم دوسروں کی خدمت کریں. یہ ہمارے اوپر خدا کے جو دوسرے فرض ہیں, سب سے پہلا فرض یہ ہے کہ انسانیت کی خدمت کی جائے. جس طریقے سے ڈاکٹر باری صاحب, ان کے ساتھی, ان کی مدد کرنے والے مل جل کے للا, کوئی پیسہ نہیں لیتے, کوئی اس قسم کی چیز نہیں ہے, انسان ذات کی خدمت کرتے ہیں. میں ان کو سلام کرتا ہوں اور دعا کرتا ہوں کہ دوسرے انسانوں کو بھی اس قسم کی कुदरत या अल्लाह ताला तौफीक दे कि इस किस्म का काम होता रहे। मैं डॉक्टर भी हूं और अभी मेरे ऊपर जिम्मेदारी सेहत के महकमे की भी है। मैं जानता हूं कि कितने प्रॉब्लम्स होते हैं। देयर आर सो मेनी प्रॉब्लम्स टू प्रोवाइड हेल्थ केयर टू जनरल पब्लिक। कितने उसमें एक्सपेंसेस होते हैं, कितने उसमें एडमिनिस्ट्रेटिव प्रॉब्लम्स होते हैं, और आप चाहते भी बहुत सारी रुकावटें हैं वो पार नहीं कर सकते। इसमें साबित कदमी चाहिए, इसमें नेक नियति चाहिए, इसमें डेडिकेशन चाहिए, इसमें परसिस्टेंस चाहिए। कभी कभी मायूसी होती है कि कोशिश कर रहे हैं फिर भी कोई इंप्रूवमेंट नजर नहीं आती। लेकिन अगर किसी ने हिम्मत से तहैया कर दिया है कि मुझे चेंज तब्दील लानी है, तो देखें बगैर पैसे के गवर्नमेंट की मुलाजमत करते हुए जब ये इरादा हो जाता है कि हमने बहुत बेहतर और इतनी बड़ी अच्छी खिदमत करनी है और बगैर पैसे के करनी है, जो कि बिल्कुल ही मुश्किल चीज़, उस वक्त मेरे ख्याल में इनके ख्वाबो ख्याल में भी नहीं होगा कि हमें कोई इतनी कामयाबी मिलती है। लेकिन जब अच्छा काम होता है तो अल्लाह ताला की मदद होती है, नेक इंसानों का साथ होता है, तो फिर वो इंशाअल्लाह ताला जो सफीना है वो किनारे लग जाता है। मैं डॉक्टर साहब से थोड़ा ही अरसा हुआ है, कोई 5-7 साल से पहले मैं डॉक्टर साहब को नहीं जानता था, क्योंकि डॉक्टर साहब माशाल्लाह जवान है, मैं बूढ़ा हूं। मैंने 69 में ग्रेजुएशन की थी, आज मेरी उम्र 75 ईयर्स है। डॉक्टर साहब माशाल्लाह जवान है, अल्लाह इनको और बड़ी जिंदगी दे कि ये और अच्छी तरीके से खिदमत कर सके। लेकिन बात ये थी कि उस वक्त हम एक प्लान बना रहे थे प्रोविंशियल गवर्नमेंट ने टू अपग्रेड द डिस्ट्रिक्ट हेडक्वार्टर हॉस्पिटल्स, क्योंकि हमें नजर आता था कि इफ अ पेशेंट इज इन थर और इन जैकबवाल, सो मेनी फार फ्लंग एरियाज, he is compelled to come to Karachi or come to Hyderabad for the treatment. Why? These were the district headquarters. We had already established district headquarter hospitals there, but they were not planned in such a way that all services could be housed on those places, and then the people would take benefit that they should not come to Karachi or Hyderabad. So we made a plan that we design hospitals at district health services, district health quarters, so that we can provide all types of services in those district headquarters. We searched people who could give us a good advice for planning the hospitals. I was not knowing, but the team which was thinking and inviting people to guide us, someone took the name of Dr. Abdul Bari. We invited him as a member of our team, Health Advisory Board, to advise us on how to build a good hospital where all services could be provided, and then how to manage it. So, in 8 years, we have developed almost in every district headquarter hospital a very good planned hospital that can give all type of services which the people of that district needs. But now we had a problem how to make good administration, because these brick and mortar, they are not going to give benefit to the people. So we as a government thought that we should make a solid ground for this. We make some legislation so that if there are so many times that government changes after every 5 years, that if the governments change, the policies change, these policies may not affect the administration or the system which we are going to introduce. So I was luckily at that time Minister for Law and Parliamentary Affairs also. We made this law, public-private partnership law, that those hospitals which we are giving to the private people to run them, they should be at least 30 years or 20 years, they should be certified that they will not be disturbed in the running the administrative affairs. So luckily, the place from which I belong, Badin, I offered Dr. Bari, requested him that please you take the administration of running this hospital. No one even knew or dreamed of that hospital in such a small place one day will be a paperless hospital and providing all the first-class health care to the people. Alhamdulillah, that hospital is working very well in Badin. I have a complaint with Dr. Bari also, that sometimes he just threatens us that please, now I am tired, I am going, leaving your hospital. तो मैं उनको कहता हूँ यार आप ऐसी बात करके मुझे डिप्रेस न करें. और कल की बात है, कल मुझे उन्होंने बहुत डिप्रेस किया. कल उन्होंने कहा कि मैं आपको अल्टीमेटम देने आया हूँ कि गवर्नमेंट मुझे पैसे नहीं दे रही, इसलिए मैं इस हॉस्पिटल का इंतजाम छोड़ देता हूँ. मैं कह सकता था कि देखें आपको और भी कुछ ऐसे वसाइल हैं जो मिलते हैं, बड़ा सपोर्ट आपको अल्लाह ताला से मिलती है नेक काम के लिए, आपके पास एंटरप्रेन्योर्स भी हैं, तो आप ऐसा न करें. लेकिन मैंने ये उनको नहीं कहा. मैंने कहा ये गवर्नमेंट की रिस्पांसिबिलिटी है कि आपको, गवर्नमेंट की रिस्पांसिबिलिटी है कि आपसे जो कमिटमेंट है वो कर लें. लेकिन अगर आप इसको छोड़ देते हैं, ये सामने बैठे हैं, मैंने कहा फिर मैं वजारत छोड़ देता हूं, मैं सियासत छोड़ देता हूं, मैं रिजाइन कर देता हूं. क्योंकि जब मैं इनको कहता था कि मेरी हॉस्पिटल ले लें, एक दिन मैं टीवी पे देख रहा था कि ये मुजफ्फराबाद के हॉस्पिटल का वादा कर रहे थे चीफ मिनिस्टर पंजाब से कि ये हॉस्पिटल मैं आपकी हॉस्पिटल में रन करता हूं. तो मैंने इनको उधर भी एक मैसेज भेजा कि यार आप कराची से उठ के वहां चले गए हैं और यहां आपके पड़ोस में भी कोई बीमार नहीं है, कोई गरीब नहीं है, कोई मोहताज नहीं है, कोई जरूरतमंद नहीं है, ये अच्छा नहीं है. फिर मैं इनको कहता था कि मैं रोजाना सोने से पहले एक दुआ मांगता हूं अल्लाह ताला से कि मुझे एक दिन और जिंदगी दे दे कि मैं इनसे ये कॉन्ट्रैक्ट साइन करवा लूं, फिर कोई बात नहीं है. तो अल्लाह का शुक्र है इन्होंने काम किया और बहुत अच्छी नेक नियति से काम करते हैं. अल्लाह ताला उनकी मदद करे. और ये जितनी बातें हम सुनते हैं, देखते हैं, ये डेली के एक्सपीरियंस है. गरीब लोग बहुत मुश्किल में होते हैं. कोई बच्ची अपने बाप से मिली हुई एक छोटी सी तोहफा शादी का वो बेच के फिर अपनी डिलीवरी कराती है. कितना जुल्म ये हो और कितना दुख की बात है. वहां हम सब जिंदा लोग बैठे हैं, खाते पीते हैं, तो हमारा तो फर्ज है कि पहले उनकी खिदमत करें, फिर अपने किसी बच्चे, अपनी किसी बेटी का सोचें. तो अल्लाह का शुक्र है हमारे मुल्क में ऐसे भी लोग हैं जो इस किस्म की खिदमत करने का तैयार करते हैं. ऐसे मुनीर साहब जैसे हैं, आप जैसे नाफ साहब बिल्कुल है, तो उन्होंने बहुत खिदमत की है हर सेक्टर में. ये नहीं कि सिर्फ हेल्थ में, एजुकेशन में, हेल्थ में. मुझे पता है बहुत सारे लोग मैं देख रहा हूँ, जानता हूँ कि वो पाकिस्तान के बच्चों को अपना बच्चा समझते हैं, पाकिस्तान के माँओं को अपनी माँ समझते हैं, पाकिस्तान के बेटियों को अपनी बेटी समझ के उनकी खिदमत, उनकी फैमिली की तकदीर को आगे बढ़ाने के लिए, समझाने के लिए, सुधारने के लिए कोशिश करते हैं. अल्लाह ताला आप सबको खुश रखे और डॉक्टर बारी साहब, उनकी टीम को और ज़्यादा तौफीक दे कि 1, 2, 4 नहीं, यहाँ वो दर्जनों अस्पतालें बनाएं, हर ज़िले में अस्पताल बनाएं और अपने जैसे बहुत सारे लोग इनको मिलेंगे जो मिलके इस सफ़र को आगे बढ़ाएं. मैं बहुत शुक्रगुजार हूँ इनका कि मुझे मौका मिला आपसे बात करने का. और मेरी सिफारिश थोड़ी कर दें कि मुझे ये डराया न करें. शुक्रिया बहुत बहुत.
The chief guest for today's evening was originally supposed to be Mrs. Saira Afzal-Tarar, Federal Minister Health. Despite all her efforts, she is unable to be here today. However, the Federal Health Secretary, Naveed Kamran Baloch Sahab, has kindly agreed to be with us here today and is the chief guest for our occasion. I would request him to give the last talk for this evening.
Auzu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Mr. S.M. Munir Sahab, Honorable Health Minister, my elder brother, Dr. Sikandar Mahendra Sahab, Chairman and the Directors of the Board, my very dear friend Salim Tabani, hopefully Amin Chinoy would be somewhere here. There he is. A very good evening to you. As said, it was basically the Federal Minister Health, rather the National Health Services Regulation and Coordination, who was supposed to grace the occasion as a chief guest, but due to her last minute, very personal commitment, she has offered her regrets. So therefore I must concede and I must confess that I am an uninvited guest, and by default I stand here. But that is much to my good fortune, for the simple reason that I was able to take a break from Islamabad, come back to my hometown, spend a few, hopefully a good weekend with my family. But more importantly, as Providence would say, I had to be reunited with Indus. And I must share with you that I think back in 2011, Amin would bear me out. Well, when working as Secretary of Finance, I got a call from my then Finance Minister, none other than Mr. Murad Ali Shah, who's the Chief Minister at this moment, Alhamdulillah. When he called me and he said, "Ke zara aa jao daftar, zara kaam hai." So I went there and Mr. Amin Chinoy was sitting there. And he said, "Do you recognize him?" I said, "I'm sorry, I don't. You know, I had not seen him with the beard and all." So the then Finance Minister introduced me to him, and he said, "He's come over here, and I believe in the cause, and we need to do something about it." I said, "Now that you've given me the vision, the facilitation is the responsibility of a bureaucrat. Therefore, I would like to put this on record that Mr. Murad Ali Shah, I hope it's not the unsung hero over here, because his support, both in terms of finances and in terms of, I would say, administrative, is probably unequivocal as far as Indus is concerned. So therefore, sir, Dr. Saab, you should be proud of your Chief Minister in this regard, and the Sindh government as far as the help was concerned. And this is the point that I would like to probably lay my impetus on, the topic being the redefinition of the healthcare. Ladies and gentlemen, as far as Pakistan is concerned right now, there has been a redefinition of the healthcare. Why I said the Minister of National Health Services, coordination and regulation, because of the fact that now health is a devolved subject. And a lot of importance lies with the province now, because they are the service delivery, not just the originators, but the responsible persons. And in that regard, if you see the spectrum of healthcare, as far as Pakistan is concerned, the public sector, the private sector, the charity, we would come to, in a certain way, this conclusion that in their own way there are flaws, but there are advantages. And Indus portrays that probably the success, which I term it as the public-private partnership. The redefinition of the healthcare, very aptly, I think, stated by none other than the eminent Ms. Sania Nishta Saiba. It's the fact that we are going through certain defining moments as well, as far as health is concerned. Defining moments, why I state that is, at this moment, the entire health indicators of Pakistan are not just poor, they are dismal. The fifth highest burden in terms of tuberculosis, malaria endemic, 7.8% prevalence as far as hepatitis is concerned. Stunting, highest, and lo and behold, they say that in terms of the prevalence of cancer as well as the heart, it's probably in the first 5. And these are all indicators which can be corroborated by WHO. Therefore, it was very important for the policymakers, including my ministry, to take this into view and to state that where does healthcare as far as Pakistan is concerned stand. Paradox, why? Because we are spending 0.7% of our GDP on health at this moment. 0.7%. Of that 0.7%, let me take this opportunity to tell you that approximately 98-90%, 99% is being spent on what we call the non-development expenditure. The non-development means employment, salary. So therefore, this is something that we shall have to think about. Success stories, Indus. Indus is there for us. So is, in my opinion, SIUT. So, in my opinion, is the cyber knife. And such examples where I've been a part of that. Part of that, fortunately, not on the other side, but on this side. The dilemma, the paradoxes that one faces is that at this moment, as alluded by Ms. Sania as well, we had almost 35 pharmaceutical multinationals which have come down to the level of now 28, and all because of certain policy decisions. Our exports have come down, sir, as referred by SMONI Saab as well. Then she also spoke about the spurious drugs. as the regulatory authority, DRAP, Drug Regulatory Authority of Pakistan, we have tried to bring certain steps towards formalizing the entire, what we call the best practices. We've had impediments, we've had a lot of, as they say, differences. However, it's a matter of immense pleasure for me to state that now we have the medical devices rules intact on one hand, whereas when we speak about the spurious drugs, we are not being aided as far as our policy of barcoding is. Why I lay emphasis on such details is that in the redefinition of the healthcare and healthcare system, it has to be a partnership. It has to be a cooperative partnership, as she said, the disruptive policy, and keeping that in view would define and redefine what healthcare is all about as to where we are moving to. In 3 diseases, HIV/AIDS, which right now, unfortunately, as far as Pakistan is concerned, according to WHO, is probably one of the very few countries which is seeing an increase. Malaria and tuberculosis. We get around 204 million from Global Fund, and that is the only money that we have for these 3 at this moment. Whereas the provinces now are in the process of making what they call adjustments in their budget. These are certain policy issues which I wanted to share with you, which are being faced by the government. You all must have heard the outcome of what the PMDC is now. 107 medical colleges, of that 66 from the public sector, private sector, I'm sorry, 49 dental, 35 of them being from the private. And lo and behold, the private sector is unregulated. There is absolutely no regulation as far as private sector is concerned. Not every healthcare is Indus, ladies and gentlemen. Whereas on the other hand, as Dr. Saab did mention, that in terms of the implementation, in terms of what we call the administration, there is not really much of an accountability, what to talk of transparency and monitoring as far as the public sector is concerned, the dilemma. However, what my experience has been that more often than not, we always state that this is due to political will. Unfortunately, 80% of that is incorrect. It is mainly due to lack of administrative will. The kachra that was alluded to by S.M. Munir Saab, I was the principal secretary then, the chief minister, Mr. Murad Ali Shah Saab, gave an open check to the administration of Karachi कि जितने पैसे चाहिए ले लें, ये कचरा उठा लें. Dr. Saab would bear me out. He was the one who said कि अगर doctors कम में जितने आपने employ करने कर लें. Both those things still remain unfulfilled. So, these things, in my opinion, would define what healthcare is all about. Healthcare is not just implementation. Healthcare is not just Indus. Healthcare is not just SIUT. Healthcare is a lot more than that. As it's almost become a cliche that whenever I convene certain meetings, I always state that I'm the odd man out because I'm not a doctor, and I'm sure I'm an odd man out over here as well. But the governance is the issue, and the governance is somewhere that one has to think about. The governance, on one hand, when we went to Germany, we speak of the ultimate healthcare system over there in Europe, whereas, let me give you an example of Iran, now considered to be in the top 3 healthcare systems as far as what we call the developing world. 7% GNP is what they spend on. So, ladies and gentlemen, of course, I should thank my minister for giving me this opportunity and not coming over here. But she was really looking forward to that. And unfortunately, as I said, couldn't make it. On behalf of the federal government, I would like to pay my gratitude and wish all the best to Dr. Bari and his team. But then Indus is something very personal to me as well. Thank you very much indeed.
Ladies and gentlemen, we are nearing the end of our inauguration proceedings. I would like to request Dr. Abdul Bari Khan to please come to the stage, and there are some tokens of appreciation that we would like to give to our guests.
These 10 years, and especially after ICON, he will be known as Mr. Barabar.
Thank you, Luka, for your kind words. Bismillahirrahmanirrahim. Assalamu alaikum. Secretary Saab, Chairman, Board of Governors, Minister Saab, Board of Directors, Hafiz Saab, distinguished guests, dear faculty, a very good evening and assalamu alaikum. It's my privilege to present vote of thanks on behalf of Organizing Committee ICON 2018. And first of all, I would like to thank Allah subhanahu wa ta'ala, because without His help, I am unable to take a step. After that, I extend a very hearty thanks to my respected guests, all of them who are here, sharing our joy, ICON 18, Inaugural and 10-year celebration of Indus Hospital. Ladies and gentlemen, events like this does not happen in a night. It takes months. The wheels start rolling months ago, and we are very fortunate to be backed by a team of motivated and dedicated professionals, faculty members, postgraduates, and whole of the Indus support staff. So, on behalf of the organizing committee, ICON 18, I would like to pay a warm thanks, hearty thanks to my faculty, my postgraduates, our PGME, our support staff, which includes housekeeping, securities who have paid In whatever way, I am so very thankful to you because the show that we are going to see in coming 2 days, inshallah, is with the support of all of them. Then I would like to pay thanks to our media partner, which is TV1, the exclusive radio partner, which is FM 107, for the support propagating icon messages. I'm thankful to the admin of Marriott for their support throughout the years, and inshallah I hope they will carry that support inshallah in the coming years. Last but not the least, I would really like to thank my organizing committee. We had different subcommittees. I cannot take each and every one name, but a special thank to my chair, Dr. Junaid Patel, who is smiling. Dr. Saida Haider, again a smiling lady at the back. And my co-secretary, Dr. Ahmed, who is unfortunately not here because of his father's illness. May his father get sehat from Allah subhanahu wa ta'ala. Ladies and gentlemen, we look forward for a wonderful session, 2-day session conference, meticulously put up and compiled by our very energetic scientific committee, for which I am thankful to Dr. Suhail, Dr. Naila. So many names, so forget me please if I forget any name. Last but not the least, I started with the name of Allah and I will conclude with the name of Allah, reciting my favorite sher, sorry from the foreigners. कोई ज़ब्त दे न जलाल दे, मुझे सिर्फ इतना कमाल दे, मुझे अपनी राह पे डाल दे, कि ज़माना मेरी मिसाल दे, तेरी रहमतों का नज़ूल हो, मुझे मेहनतों का सिला मिले, मुझे माल और ज़र की हवस न हो, मुझे तो रिज़्क़ हलाल दे. Ladies and gentlemen, with that I conclude, and dinner is served, and I look forward to see all of you inshallah in upcoming scientific sessions. Thank you all.
Sorry, I want to speak. Ladies and gentlemen, as you walk out, please continue walking out. For the participants for the scientific sessions tomorrow, strict instructions from Dr. Suhail Akhtar. Please be here by 8:45 a.m. We will start it promptly on time at 8:45. Please keep traffic in mind, leave homes earlier and be here in time. Thank you very much.
Bernadetta Bellarida from the World Health Organization in Geneva. I work with the neglected tropical diseases with people who are underserved, and Indus Hospital seems to be the nexus of Pakistan, who is focusing on treating and taking care of the underserved populations. And I think this is a great impact for this sector of society.
अस्सलाम वालेकुम, मैं ज़ेबा बख्तियार हूँ और मैं इस वक्त इंडस हेल्थ केयर नेटवर्क आइकॉन कॉन्फ्रेंस के एक फंक्शन पे आई हुई हूँ. सबसे पहले मैं ये बताऊँ कि इंडस हॉस्पिटल वो जगह है जहाँ पे मेरे ख्याल में मैं आके जब भी मैं इंडस के किसी फंक्शन में आती हूँ मुझे लगता है कि वाकई मैं इंसानियत का हिस्सा बन गई हूँ और उन लोगों का हिस्सा हूँ जो वाकई कुछ कर रहे हैं. मुझे बड़ा फ़ख्र है कि मैं इंडस हॉस्पिटल के साथ एसोसिएटेड रही हूँ. मुझे यहाँ आने का मौका मिला है एज अ वॉलंटियर, एज अ पर्सन हु फील्स दे आर पार्ट ऑफ द इंडस फैमिली, क्योंकि इनका जो काम है बेमिसाल काम है पाकिस्तान में हेल्थ केयर के हवाले से. और अभी साइंस और रिसर्च के लिए आइकॉन अरेंज हुआ है जो एक कॉन्फ्रेंस है टू फर्दर डेवलपमेंट्स इन साइंस एंड रिसर्च. इंडस का काम سب کے سامنے ہے. اس کی جتنی تعریف کی جائے وہ کم ہے. تمام دعائیں انڈس کے ساتھ. السلام علیکم.